What's up, everybody? All right, good evening, everyone. I'm Dr. Joaquin Acosta, your host for tonight's Know Your Pharmacist live stream and the proud CEO of Pharmtrue. We're here on this splendid evening, February 12, 2024, to embark on a journey through the captivating world of healthcare, where innovation meets compassion and knowledge transforms into empowerment. Tonight, we delve into a topic that resonates with each of us, the safety and efficacy of semaglutide, a medication that's been a beacon of hope for many, yet presents many challenges we must navigate with care. As we explore this, remember every insight we gain is a step towards better health for ourselves and our loved ones. We're also stepping into the future with Microsoft's AI advancements in healthcare. Recognizing my favorite commercial, Microsoft Copilot, was a good one there, guys, on Super Bowl Sunday. I don't know about you and your favorites, but the future is now. It's not just a dream, it's becoming a reality, and tonight we're exploring its incredible potential. But that's not all. We'll also be discussing the Super Bowl's aftermath, not just in sports, but in the broader context of health and wellness. What happens on the field doesn't just stay there, it echoes into our lives, shaping our perceptions of health and teamwork. In our Herbal Wellness Corner, sponsored by the trailblazing Horse Cannabis Company, we'll dive into the neuroprotective properties of CBD. This isn't just about cannabis, it's about understanding how nature's gifts can be harnessed for our neurological health. We'll also pay a heartfelt tribute to Officer Jonah Hernandez, reminding us of the human spirit's resilience and the strength of our community. And in our Men's Health Minute, sponsored by the exhilarating Vado Speedway Park, we'll shed light on the relationship between alcohol consumption and health, a topic that touches many lives, often in ways we don't fully realize. This evening is not just another live stream, it's a commitment to learning, growing, and transforming together. So tune in, engage, and let's take this enlightening journey to a healthier, more informed world. Together, we're not just viewers and speakers, we're a community united by the desire for knowledge and wellness. Thank you for joining me, Dr. Joaquin Acosta, on this adventure. Let's make this evening a milestone in our collective journey towards health and enlightenment. Jumping right in. Some interesting headlines that keep their way into the news. America's Poison Control Centers reported 1,500% surge in calls involving accidental overdoses related to weight loss drugs. Pretty crazy, right? Very interesting, because this was in one drug in particular, and that's semaglutide, something we seem to be almost talking about on Mondays at this point. But, American Heart Health Month, weight loss, heart health, they're all supported very well with one another. And some of us might be having the reciprocal effects of, positive cardiovascular health from losing weight, maybe taking semaglutide, whatever. But, 1,500% surge in calls involving accidental overdose related weight loss drugs. People buying this stuff, unsourcing it from wherever, not knowing where they're dosing it, how they're dosing it. That's just a very interesting stat there, right? Poison centers across the country say they've seen an increase in calls involving accidental poisonings related to the injectable medication semaglutide used for type 2 diabetes and weight loss. America's Poison Control Centers, which operates the National Poison Helpline, told People magazine that its 55 poison centers fielded 2,941 calls January through November in 2023, marking 1,500% increase since 2019. In 94% of the calls, semaglutide was the only substance reported. Some affected people were hospitalized with symptoms including vomiting, severe nausea, and abdominal pain. However, most cases were resolved with treatment such as IV fluids and anti-nausea medications. Dr. Kate Brown, clinical managing director of the American Poison Control Centers, told CNN that dosing errors were often reported by a majority of the callers. Oftentimes, it's a person who maybe accidentally took a double dose or took the wrong dose. Brown told the outlet. Semaglutide, which was approved by the Food and Drug Administration in 2017, is sold under the brand name Ozempic and Wegovy. A number of celebrities spoken out publicly about using medications, among them Sharon Osbourne and Robbie Williams. In 2023 June report published in the American Journal of Pharmacy Association, Dr. Joseph Lamson, director of the New Mexico Poison and Drug Information Center, studied 3 people who called the Utah Poison Control Hotline and reported experiencing adverse symptoms after taking a semaglutide medication. 2 of the people accidentally took 10 times the amount of the standard drug dose. In the report, Lamson pointed out that the compounded versions of the medication, which typically come in multi-dose glass vials, as seen in the picture, require patients to draw their own doses into syringes. He noted that these versions lack the safety features provided by the pre-filled pens used by the brand name makers of the drug. These three semaglutide cases highlight the potential for patient harm given current practices. Vials of compounded semaglutide do not safely measure the features that pre-filled manufacturing pens are able to maintain and allow for large overdoses, such as a tenfold dosing error there. Uses of syringes not intended for semaglutide contributing to the variability of the dosing units, milliliters, units, milligrams. If you get the brand name semaglutide, you pay the $1,000 for the box. Those dose pens are calculated. You can see it on the pen. You know exactly how much you're going to get. If you're going to be eyeballing it out of a clear glass vial like that, not only also questioning, right, the stability of these formulations, because the compounded, semaglutide, especially over these online pharmacies, may oftentimes not have even been semaglutide. So that's, very important things just to consider there, where you're sourcing it, where you're getting it from. Obviously, if you're getting it from a licensed practitioner, you're in a good spot. They're going to dose it for you. You're much safer than you doing your DIY kit, online surfing, online shopping, and online dosing, right? That can get you into these kinds of pinches. Obviously, 1,500% increase in reported calls. A lot of people were getting in these pinches. In terms of looking at a UNM health expert weighing in on this, just to go in a little deeper, New Mexicans, we had 23 calls about semaglutide in the year 2023. So 23 calls to the New Mexico Poison Control Center. Obviously this is a big issue nationally, but New Mexico, we weren't as bad, I guess, or whatever that means. It's good people call and ask. That New Mexico Poison Control Center is a free resource at any given time. And, for those who sometimes will call these poison control centers, they'll charge you like $100 just to answer a question, right? And that's some insane stuff, because you can obviously have that data for free as a state resource. Anyways, let's jump into tech talk, guys. Favorite Super Bowl commercial? Who's with me on this one?